Alright, so I'm going to make a video pretty much just describing the factors that ultimately leads to increase in VO2 max. So you know that you get your increase in VO2 max by training, and these are some of the effects that happen as you train. Okay, so just to point out that the two main factors in increasing VO2 max will be your max cardiac output and your increase in AVO2 difference. And your AVO2 difference is pretty much just the difference between the arterial and venous side pressure and how much oxygen is extracted from the rate of blood. Okay, so as we go down, the arrows mean that they contribute to the increasing or decreasing of each factor, and the red arrows are, as they stand, increasing and decreasing. So we will start with stroke volume, okay? Now from stroke volume down, these are factors that affect stroke volume, okay? So first I'm going to say that stroke volume is the amount of blood ejected from the heart or ventricles, however you like to think about it, during each beat, okay? So stroke volume is really important. So we have three factors that influence stroke volume, okay? And that's preload, contractility, and afterload, okay? Now preload is the amount of blood in the heart after relaxation or in diastolic volume, okay? So that is the amount of blood sitting in the heart after it's relaxed and is getting ready to be ejected, okay? So contractility is how fast the heart likes to work, how fast it likes to beat, okay? So you can just kind of think of it like that. Afterload is the amount of blood that is in the aorta after the blood is ejected. So if you can picture, I'll even draw it right here just so you can get a kind of a glimpse of it. Alright, so here's my heart, okay? And right here, we'll just say, is my left ventricle, okay? And we all know that the heart is ejected into the rest of the blood that is ejected into the rest of the body comes from the left ventricle, which is like the last stop in the heart before it gets dispersed, okay? So right here would be our aorta, okay? So the blood ejected will go through the body and come back around. The amount of blood or pressure that sits right here is called your afterload. So you can look at it as the amount of blood or the pressure, okay? And this is really important because the amount of blood or pressure can determine your effect on stroke volume. So if you have a decreased afterload, which means there's less pressure and less blood for the heart to push against to send blood out into the body, that will give you an increase in stroke volume because it doesn't have to work as hard. Now if you have an increase in afterload, if you have more pressure than the heart can pump out, it's going to be a decrease in stroke volume, okay? So it's an inverse relationship. Alright, so you have your preload, contractility, and afterload that affect your stroke volume, okay? So we're going to move down to the factors that influence the increase in preload, okay? And remember, preload is the amount of blood that is in our heart after relaxation is getting ready to be ejected, okay? So three factors that influence plasma volume, or preload, I'm sorry, are plasma volume, your filling time, and venous return, and ventricular volume. So plasma volume, increase in plasma volume just means that your blood that's coming to the heart is thicker, okay? There's more of it. There's more blood coming to the heart, okay? So increased filling time and venous return. Increased filling time is exactly what it sounds like. It is a longer process for your heart to fill up, okay? So if you have thicker or more volume coming into your heart, you're going to have an increased filling time because all that blood needs to get into the heart to be ejected to go throughout the rest of the body. And venous return is pretty much just the blood that is coming back to the heart after it's gone through the systemic circuit, okay? So if you have increased venous return, more blood being returned to the heart, you're going to have an increased filling time because the heart has to fill with that blood coming in, okay? Ventricular volume is just the amount of blood that the ventricles can hold to be ejected. So I have the explanations all in blue if you don't understand or follow me during this video. If you have the increased ventricular volume, that means that your ventricles can hold more blood, okay? And when you can hold more blood, that will increase the preload, which is the amount of blood that is relaxed and waiting to get ejected, and then it'll ultimately lead into an increase in stroke volume, which will lead into an increase in cardiac output, which is where we want to get the increase in VO2 max from, okay? So I hope that was pretty self-explanatory. If not, you can just kind of read off of these little blue bullets, okay? So we're coming over to the AVO2 side. Again, AVO2 is pretty much just the difference between the arterial and venous side of oxygen/pressure. Can't really remember, but an increase in AVO2 is brought on by the amount of oxygen that is extracted from the blood, okay? So how much oxygen can get pulled in from the blood is where the AVO2 difference comes from, okay? So you have ultimately two things that influence the extraction rate of oxygen from your blood, and that would be muscle blood flow and capillary density. So muscle blood flow is just what you think it is blood flow to the muscles, and an increase to the blood flow to the muscles, we know that the muscles love oxygen during exercise, is going to create an increase in AVO2, okay? Now, increase in capillary density is a little bit more complex. Your capillaries is where you exchange your nutrients and all that good stuff when the blood's flowing around. So when you're at rest, you not necessarily have all your capillaries working because they're not needed, so you don't need to use them all. Well, when you have exercise, your capillary density is going to pull those inactive capillary beds that aren't being used into being used for exercise, because the thing is that when you have more muscle blood flow, you need more capillary density. So as it says right here, the increase in capillary density is due to the increase in blood flow. You have an increase in blood flow, you need more room for that blood to come through your capillaries, so it recruits the inactive capillary beds, okay? So when you increase the capillary beds, so if I started with 2 capillary beds during exercise, I might get 5. I'm just going to make this look like a bed. It doesn't matter because that's a terrible drawing. But this would be exercise. This would be rest. Okay? So if you increase the capillary bed, the rate at which oxygen or gases can be diffused is going to decrease, which means that it can transport its gases quicker. Okay? So because you have a bigger bed increase. Okay? And since you have a bigger bed increase, it's going to allow the blood flow that is coming into the capillary bed to slow down. It's going to slow down because it has more capillaries to go through. Okay, so it's not just rushing through 2 of them; it's going evenly throughout 5 or thousands of it. So that is what that is. That's kind of confusing. I'm sorry if I didn't explain that quite right. Okay. So, and now we have a big factor in our whole VO2 max is our sympathetic nervous system. Now, if you don't know what the sympathetic nervous system is, it's pretty much your, what it does to your vessels is it constricts or dilate. Dilate means it opens more. Constrict means it closes your vessel. It also has a really big factor in dealing with its own control over the heart. It's pretty much the primary system that controls the heart's contractility, okay? So a decrease in the sympathetic nervous system to the working muscles is going to take away that vasoconstriction factor, and it's going to allow the vessels to dilate, which means they're going to open up. And when our vessels open up to our muscles get more oxygen, they get more blood, we work harder, and we have better performance, okay? So this kind of has two factors on the heart. If we have a decreased sympathetic nervous system on our afterload, and remember our afterload is that pressure that is left in the aorta after ejection. So if we have a decreased sympathetic nervous system reaction on the afterload, it is going to increase our stroke volume, because if you could imagine that if I had the aorta in my hand right now and I increase my pressure, it's going to be really tight. It's going to be really hard for the blood to get through that, okay? Now, if I decrease my sympathetic nervous system, I'm going to open up. I'm going to release that tension, and it's going to allow more blood to flow through, which is going to decrease our afterload, okay? But contractility is different. I don't have an arrow, but if we have stimulated our sympathetic nervous system for contractility, our heart's going to beat faster and work harder, which will increase our stroke volume to cardiac output and lead to an increase in VO2. And that's pretty much it. I think that does a really good job at explaining it, despite a couple of fumbles, especially talking about the capillary density. But that's the big picture, and I hope it helps.